biphasic treatment, first thing you want to do is make sure the cable's connected. Make sure you connect the electrodes and probes. Then make sure you clean the area that you're trying to treat to increase resistance. Then make sure you put the pads on. Make sure you put one pad on distally and one pad proximally to the injured area. So this is the distal pad, this is the proximal pad, this is the injured area. So then the next thing you want to do, make sure you put biphasic. Then afterward, change this to normal. I would go to continuous. Make sure that there's no rest in between the pulses, so don't give me any time for gate control theory to happen. Then I had put the ramp up to keep the ramp at 1.5, so that the gradual increase in maximum intensity is comfortable for the patient. Then for time, to give it enough time, I would go up to 15 minutes. I could do either 15 or 20 minutes to give it appropriate enough time for treatment. Then pulse rate, I would go up between either 50 to 100 for sensory function. So for this, I'm basically gonna go up to 60 to give it a little bit more in the middle range of the estimate of the treatment for sensory. Then I would go to pulse duration. I would go down to under 100 if I want to do sensory function for the treatment. Then if I wanted to do any type of motor treatment, then I'll go up between 200 to 400. Also, make sure you monitor, make sure I see that ramp is good. Then I go up to intensity. I would go up in intensity, make sure I ask the patient when they start to feel any tingling.
Okay.
Just let me know. Once I keep going up there and the patient tells me to start feeling some tingling, then I go up a little bit more. Make sure I see no muscle contraction occurring at the site. Then I would press start the treatment there. Make sure I monitor there's no muscle contraction there. So for this treatment, what I would look for contraindications, make sure that the person isn't pregnant, has any arterial diseases, doesn't have a metal implant in their body, make sure that they have no pacemaker in the body as well, and to finish off the treatment, make sure everything is stopped. Make sure I press stop on the treatment when it's over. Make sure nothing's on no more. Make sure I disconnect all the cables. Make sure I disconnect the probes. Take it all off. Make sure I ask the patient how they feel. Make sure they're not feeling any pain. And then make sure I disconnect everything, turn it all off, and that's the biphasic treatment.